This video is on acetylcholine, how it is synthesized and how it is metabolized. Actually, it is a neurotransmitter which acts on receptor. There are two receptors it acts on. One, muscarinic receptors. Two, nicotine receptors. Nicotinic receptors. Next, synthesize. Actually, it is synthesized by two components and one enzyme. One is acetyl-CoA. Second is choline. Acetyl-CoA comes from mitochondria of neurons. Choline is from systemic circulation. That means from blood. And there is one enzyme which helps in this reaction, that is choline acetyl transferase. In order to formation of acetylcholine. It is the important enzyme, helps in formation of acetylcholine. After formation of acetylcholine, it enters into vesicles and stored. Vesicles of neurotransmitters present in synapse. Now, acetylcholine present in vesicle in the synapse. When the action potentials comes, it depolarizes presynaptic membrane and leads to open of calcium gated channels. Depolarization of presynaptic membrane makes the influx of calcium ions. These calcium ions makes the vesicle to contract and fuses with the presynaptic membrane. Vesicle bind with presynaptic membrane and releases acetylcholine into synaptic cleft. It is the synaptic cleft. And acetylcholine acts on receptors which presents on postsynaptic membrane. When acetylcholine binds to the receptors, leads to open of sodium channels. An influx of sodium channels seen and it depolarizes postsynaptic membrane. Then action potentials generates in postsynaptic membrane. This is how acetylcholine works. But in synaptic cleft, there is enzyme which we call acetylcholine esterase. And it is the enzyme which metabolizes acetylcholine. It is present in synapse, metabolizes acetylcholine. Let's see how it is metabolized. Actually, this enzyme has two sides. One is esteric side, which has enzymic activity. Another one is anionic side, which is negative in charge. When acetylcholine released into synapse, these acetylcholine esterase takes acetylcholine and tries to break. In acetylcholine, choline is the positively charged, so it is going to bind with anionic site. Ester site has enzymatic activity. So it's go and breaks the acetylcholine bond. So acetylcholine separated by esteric site of acetylcholine esterase. In the synapse, choline is reuptake by presynaptic membrane. So it is the rate limiting step. This is how acetylcholine metabolize. Let's see which drugs acts on acetylcholine synthesis and mechanism. There are some drugs like hemicolinum, which inhibits choline reuptake from the synapse. Second is vasomicol. It is also a drug which prevents entry of acetylcholine into vesicles. And there are aminoglycosides. Actually, they blocks calcium channels on presynaptic membrane to prevent release of acetylcholine into synapse. And there are some drugs includes like beta bungarotoxin. It is the drug directly blocks release of acetylcholine. It is the synapse acetylcholine releases into synapse, and there is acetylcholine esterase. Here calcium channels, receptors. 1. Hemicolinum. It inhibits after metabolization of acetylcholine, choline reuptake take place. This hemicolinum inhibits uptake of choline. Second is vasomicol. Actually, it inhibits entry of acetylcholine into vesicles. And third one is aminoglycosides. It inhibits open of calcium channels. So there is no depolarization of presynaptic membrane and there is no chance of releasing acetylcholine into synapse. And there is a one question like, what if acetylcholine increases in presynaptic membrane? In this we can use calcium ions as treatment. Usually acetylcholine acts on bronchi muscles to contract, leads to physiology of respiration. when we give beta bungarotoxin, or if the patient or if any person if infected by the bungarotoxin or botulinum toxin, it directly inhibits release of acetylcholine. When release of acetylcholine blocks, there is no action or stimulation on NM nicotinic receptors,